Welcome to my YouTube channel. In this video we will talk about colon cancer, also known as colorectal cancer. Colorectal cancer, cancer of the colon and rectum, continues to affect millions of men and women worldwide, and understanding the disease and what we can do to prevent it is the first step toward a cure. Colorectal cancer statistics. Colorectal cancer is the third most common cancer diagnosed in both men and women in the U.S. Although the death rate from colorectal cancer has been dropping for the past 30 years, it is still the second leading cause of cancer death in the U.S. The overall lifetime risk of developing colorectal cancer is 1 in 21 for men and 1 in 23 for women. There are currently more than 1 million colorectal cancer survivors in the U.S. Here's a list of 9 facts you need to know about colorectal cancer. And make sure you read about related work by NFCR-funded scientists Dr. Wei Zhang, Dr. Daniel von Hoff, Dr. Lawrence Hurley and Dr. Young Kai Cheng. 1. With regular screenings, colorectal cancer is preventable. Colorectal cancer screening saves lives. In many cases, a screening can prevent colorectal cancer by finding and removing polyps before they turn into cancer. Screening also helps find colorectal cancer at an early stage, when treatment is most effective. Studies show that regular screening could prevent 1/3 of colorectal cancer deaths in the U.S. The 5-year survival rate is 90% if detected early. 2. Age is the #1 risk factor for colorectal cancer. 90% of colorectal cancer cases appear in men and women 50 years old or older, and the risk for developing this cancer increases with age. Yet, like most disease trends, this isn't absolute. Younger people can get colorectal cancer too. 3. There are warning signs, but not early warning signs. Like lung cancer and cervical cancer, colorectal cancer can be hard to detect in its earliest stage. Symptoms can include a change in bowel habits, blood in the stool, diarrhea, constipation or feeling that the bowel does not empty all the way, frequent gas pains, bloating, fullness or cramps, weight loss for no known reason, nausea, tiredness and vomiting. If you experience any of these symptoms, contact your doctor right away. 4. Lifestyle choices impact colorectal cancer risk. Many lifestyle-related factors are directly linked to colorectal cancer risk. Obesity not only increases your risk of having colorectal cancer by 30%, but it also increases the likelihood of poor treatment outcomes and complications. Smoking also increases your risk of developing and dying from this type of cancer. One recent study reported that patients with colon cancer who smoke were 14% more likely to die from their colon cancer within 5 years than patients who had never smoked. Other risk factors include heavy alcohol use, lack of exercise and diets high in red and processed meats. Additionally, cooking meats at a very high temperature can create chemicals on your food that may increase your cancer risk. 5. Family history matters. People with a first-degree relative, parent, sibling, offspring, who has colorectal cancer have 2 to 3 times risk of developing this disease. A personal or family history of polyps, adenoma, also puts you at higher risk, especially if the polyps are large or if there are many of them. 6. Health conditions can increase your risk. Your risk of colorectal cancer increases if you have the following conditions: Type 2 diabetes, inflammatory bowel disease, IBD, including either ulcerative colitis or Crohn's disease, and having an inherited syndrome like familial adenomatous polyposis, FAP, or Lynch syndrome. 7. Regular colorectal cancer screenings typically begin at age 50. Because polyps tend to be seen most often in people 50 years of age and older, experts recommend universal screening for colorectal cancer beginning at this age. If you are under 50 and have a family history of colorectal cancer or other risk factors, talk to your doctor about when you should start regular screening. 8. There are different screening options. Screening tests can include colonoscopy, sigmoidoscopy, barium enema, CT colonography or virtual colonoscopy, and at-home tests like the fecal occult blood test, fecal immune testing or stool gene testing. Talk to your doctor to see what screenings are most appropriate for you given your family history, age and lifestyle choices. For more information on cancer screenings, please refer to our. Thanks for watching the video. Don't forget to hit the like, share and subscribe button.